Uh, Today we are going to discuss the third module for the fellowship in internal medicine, and we will be discussing the two major headings. This is going to be a very long and a complex chapter, but I am going to make it simple so that you have a gross idea of what is happening. The first part of the module is water and electrolyte balance, and second will be disorders of water and electrolyte balance. So we will see first how water levels and electrolyte levels are balanced in the body, and then we will go on to discuss the common clinical disorders we come across as clinicians as far as the water and electrolyte levels are concerned. So there will be two parts for this module, and this is going to be a long talk, a little bit complex, but I will try to make it a little simple. We all know that life has started from sea, and majority of our body is composed of water. And the water distribution in human body, you know that water is the most abundant constituent of the human body. And the normal water content of body is about 50 to 80%. That is roughly your half to 4/5 of your body weight is water. So primarily you are walking water bags. And the water content in men is higher than females due to lesser fat content. If you are having excess of fat, there will be lesser fat content in the human body. And the water content tends to fall with the age as well. So this is a schematic representation of the distribution of water in human body. There is slight difference as far as the male and female is concerned. In females, about 45% is solids and 55% is fluid or water. And the 45% solid includes the muscle, the bone, and the fat content. Again, males who are having a higher amount of muscle will have a higher water content in their body. So about 60% of their body weight is fluid and 40% is solid. Again, if you take the water content, you know that the 2/3 of the water content is intracellular. Pardon me. It's the intracellular and 1/3 is extracellular. So most of the water content in your body is inside the cell. Only a small amount or 1/3 of the amount is in the extracellular space. And again, in the extracellular space, the 80% is in the interstitial fluid. That means you can see that there is a cell membrane, and between the cells, there is a small space known as the interstitial space. So about 80% of the extracellular fluid is in the interstitial fluid. And only 20% of that 60%, 1/3 of the extracellular fluid volume is inside your blood vessels as the plasma of the blood. And there is always an exchange between the plasma in the blood vessel, the interstitial fluid, and between the interstitial fluid and the intracellular fluid. So all this fluid is actually, though separated by the cell membrane and by the blood vessels, all these fluids are in exchange with each other. And the electrolytes also move between these fluids, but with the help of some transporters. So we will discuss about how this mechanism happens, how the body regulates this, and why it is important to keep the total body water content of the water, etc. We will discuss.